Hello, this is Dr. Hausinger, and this lecture is concerning Chapter 9 in your SAC book, Successful Service Programs. It is a relatively common sense chapter. I think that there's not a lot of additional information that we can really say. The chapter goes over the Affordable Care Act and some other important policy changes that really have made our field a lot more legitimate and much more mainstream and comparable in terms of other healthcare services. So the learning objectives for our chapter are to summarize 3 current trends in substance abuse program services, contrast the advantages and concerns of managed care for substance abuse services, discuss the importance of the Affordable Care Act of 2010 for substance abuse services, contrast the various methods of conducting a needs assessment, explain the relationship between process evaluation and management information systems, and discuss the issues of multiculturalism and social justice as they affect substance abuse services. All right, so first off, effective programs depend on practitioners who are sensitive to environmental contingencies and are adept at carrying out planning and evaluation services. Programs fail when objectives are diffuse, their activities poorly organized, or their accomplishments are unmeasured. Okay. So, we need to have an emphasis on accountability for achievement outcomes. Part of that can be the HIT, Health Information Technology. It is mandated that we use computers now. However, technology will always fail, and so most agencies do have backup records as well. So what that looks like is we usually have records that are electronic, and then we print those records out and store them in a file in a locked cabinet in a locked office. Other trends include the privatization, contracting, and other forms of cost savings, replacing customary funding mechanisms, a replacement of autonomous practice with an insistence on interagency collaboration, including coalitions between public and private sector organizations, a replacement of the long-established routine of screening clients to determine whether they fit, with the expectation that programs will tailor services to the individual's assessed needs, and a replacement of the time-honored bureaucratic skills that formerly kept programs afloat with marketing, public relations, and entrepreneurship. Okay. So what is managed care? Managed care is a system that's designed to control the quality and cost of healthcare through such methods as placing limits on access to services, selecting service providers, and enforcing cost containment. So we have HMOs and MBHOs, Managed Behavioral Health Organizations. And on page 212, they talk about the 4 main generations of managed care. So the first one is reducing costs by restricting access to services through overly rigid utilization review, limited benefits, and large copayments. So it was less about the services that you could receive, but reducing costs to the agencies themselves and less about patient care. The second generation care organizations focus on the development of provider networks, selective contracting, increased treatment planning, and a less rigid utilization review process. Third generations focus on managing the care of enrollees by emphasizing treatment planning and carrying out more active management of clients through the course of treatments. This involves enhancing the breadth and seamlessness of the continuum of care and actively using the least restrictive treatment centers that are clinically appropriate. And a fourth generation, now being inspired to, is to manage by outcomes. The model seeks to focus on the outcomes of treatment and allows great provider autonomy regarding how the outcomes are achieved. Right. In Chapter 4, we looked at assessment in depth, and those are our placement criteria. So we have the 6 ASAM dimensions that we look at, and we have our levels of care, the 4 levels of care: early intervention, outpatient services, intensive outpatient / partial hospitalization, residential / inpatient, and medically managed intensive inpatient service. Okay. And remember that we are screening and assessing not just for substance abuse, but for all areas of the person's life. So something really important that happened was the Mental Health Parity and Addiction Equity Act of 2008, which means that services have to be equal. Benefits for mental health and substance abuse have to be comparable to physical health services. All the financial requirements and treatment limitations applied to mental health and substance use benefits can't be more restrictive than for physical health benefits. And equal cost sharing, meaning that the law prohibits the use of higher patient cost sharing deductibles, copayments, maximum out-of-pocket costs for mental health and substance abuse benefits than for physical benefits. Okay. The Affordable Care Act of 2020 mandated that all insurances, including public health insurance, cover some type of substance abuse and mental health treatment. So it's AppleCare, it's Molina, Provider One, Medicare and Medicaid, and then of course all the private insurances as well. And we're hopefully seeing a continuous expansion of people that are able to be on health insurance as well. So looking at program planning, you can't just make a program up. It has to have checks and balances, and effective programming depends on a very strategic and step-by-step planning process that includes assessing needs, identifying desired outcomes, generating alternative methods for reaching goals and selecting among these alternatives, devising implementation and evaluation plans, and budgeting. Okay. So of course we start with the needs assessment, and as we talked about in chapter 4, that can look like, well, for the actual clinical assessment, we do different types of questionnaires, but how do we assess and plan a program? Okay. We might do community surveys, looking at demographic changes and social indicators, which are our quantitative statistics. The Department of Health sometimes calls people to do surveys. Public forums are a very important part of figuring out what are the community's needs, what services do we have, what's lacking, and where can we improve things. And then we have key stakeholders and key informants such as neighborhood leaders, political figures, or individuals who make them sensitive and intuitive to the community needs. Okay, there we go. Great. So then when we have this, we have to identify what are our desired outcomes and how are we going to have the means justify the ends. We have to look at alternatives because there's always alternatives. Developing implementation and evaluation plans and the actual evaluation. And this is really important. As we look in the policy class, prevention programs only work when they are executed properly. So people need to be properly trained on the curriculum and how it's going to be executed within whatever space it's going to be given in. And then how are we going to evaluate? So we need to have that checks and balance the entire way through. And it's a continuous assessment. So for evaluation, we can evaluate the process. So again, it's not just the beginning and the end, but actually looking at how we're doing as we're rolling things out, our goals and objectives, our management information systems, such as computer records. Are we doing statistics? How are we getting feedback from the people that are doing the program, both participants and stakeholders? And then so we're looking at the process and also the content and then also the outcome. So we have to look at the various variables of our outcomes. Did we get expected results that we were anticipating? Were there other interesting positive things that happened that we were anticipating? Did we have something interesting that occurred that was an oversight? So then really the only way to evaluate the program is to go through the program and then consistently alter it and see what can be done as the needs of the participants and potentially the population changes as well. So we need to have look at our multiple variables, our assessment instruments, and then the follow-up procedures. And when we're looking at developing programs, we have to know our audience. We have to have multicultural considerations, and looking at this through a social justice perspective with multicultural competence, which again, cannot stress this enough, is ongoing. And then of course, first and foremost, would be the ethical considerations. is what we're doing ethical? Did something come up across the way that kind of questions things, right? And if we're advocating for social policy reform as an ethical priority, then we need to make sure that our programs don't have adverse consequences.